Good morning, everyone. I'm Sue Stroop, the Senior Career Consultant for UK Healthcare. It's so good to see all of you today. We have about 20 people registered for our Lunch and Learn. Today's topic is UK College of Public Health, and they will be talking about their Master's in Public Health, their Doctorate in Public Health, and their Master in Health Administration. I'm excited that Benji Bryant is joining us today and will be speaking. I'll introduce him in about another minute when we officially get started. I see some of you still coming on board. So I've got about, well, now it's exactly 11:30. So again, I'm Sue Stroop. I'm the moderator today for today's Lunch and Learn, featuring our UK College of Public Health, their MHA, Masters in Health Administration, their Masters in Public Health, and their Doctorate in Public Health degrees. I'm joined by our speaker and colleague and friend, Benji Bryant. Benji is a current graduate coordinator at the University of Kentucky College of Public Health. He's worked in higher ed and has served students for 21 years at 2 different universities, including UK. During today's Lunch and Learn workshop, Benji's goal is to shed light on various opportunities offered by the College of Public Health to current UK healthcare employees to further education and possible advancement. And he looks forward to your questions during the question and answer presentation. A little bit about the format today. If you've not attended one of our Lunch and Learn workshops, these are every month. They are video recorded, and so if you want to go back and look at it later, it will be available on the UK Healthcare Career Center web page. We're going to have 30 minutes of Benji talking and presenting all the information about the degrees, and then we'll open it up to question and answers at noon. And he did collect your question and answers, so he will try to address those as well. So without further ado, I'll kick it over to Benji.
All right. Good morning for the next 29 minutes. After that, good afternoon. Thank you, Sue. Thank you, Kristen, for putting this together or assisting. I really appreciate it. I've talked with this group several times, and I like to keep things somewhat informal. So if you all have any questions, please raise your hand virtually or put it into chat. I'm also going to try to get through as much of this as possible without coughing. I'm fighting allergies, as I'm sure most of you are aware. It's that season in Kentucky. So I'm going to do the best I can. Bear with me. But I'm here today representing the College of Public Health. Hopefully you've heard of us. We are one of the smallest colleges on campus, which sometimes plays into our benefit when it comes to class sizes and connections, networking, things of that nature. So a little bit more about us. We were established in 2004. So if you did the math, last year was our 20th anniversary as a college. We're fully accredited at the bachelor's, master's, and doctoral level. We just went through our re-accreditation process this past June. So all of that is freshly completed. We are one of 6 health-related colleges at the university. Again, we're a small college, approximately 225 graduate students, 300 undergraduate students, but we are growing. We just finalized our first 100 person incoming freshman class for next fall, so that's awesome. And we have a very strong domestic and international alumni network. So Sue wanted me to touch on this. This is in relationship to our Bachelor of Public Health, a BPH program, but it's a partnership with the nursing school, Public Health Nursing Scholars, also known as the FINS program. This is a great opportunity. It is only available to incoming freshmen. So if you want to look at this joint degree, there has to be an incoming freshman component. But if you are interested or have questions, the contact person for both the BPH and the FINS program is Hannah Dunsmore. Her email is at the bottom right, as well as there's a QR code to apply. All right, so just an overview of our graduate programs within the college. At the master's level, we do have the MPH, Master of Public Health. We have an MHA, Master of Health Administration. We also have 2 MS degrees, Master of Science in Biostatistics and a Master of Science in Epidemiology. They all have a part-time path if you're interested in those. I'll get into more details about that in a second. But also on the graduate certificate side, we have biostatistics, we have improving healthcare value, which coincides with our MHA program. So you could receive both accreditations at the end of your time with us. And then we have an online certificate called Population Health, and it coincides with our MPH program. At the doctorate level, we have our PhD in epidemiology and biostatistics. Unfortunately, admissions for that PhD program is closed for next fall. They're going to go to an every other year format. And then freshly launched as of this semester is our online DRPH, Doctor of Public Health program. It is still in the growing and planning phases. As I mentioned, this is our first cohort in the fall of 25. And so that is ever changing. Speaking of our MHA program, Master of Health Administration, it's an in-person program with a part-time track that lasts 4 years. As a full-time student, it would be a 2-year program. It is 50 hours, 50 credit hours. But in those 4 years, you would use your EEP benefit, which we will talk about in a little bit. And so you would avoid the cost of tuition. But I think the limit on that is around $5,000. And so once you reach that $5,000 mark, you would have to pay taxes on the tuition. But there's a big difference between paying tuition and then paying taxes on tuition. Again, there's a QR code and a contact if you have any information or any questions or need information about the program. If you want to contact me, I'm happy to forward these messages on to these people. But Ashley Harden would be your contact person for MHA information. All right, so the MPH at UK. I apologize. We offer dedicated professional staff and support team for advising. If you're in the MPH program or the DRPH, I will be your advisor. Not all graduate programs have graduate advisors, so it's an opportunity to get that one-on-one interaction and one-on-one guidance through the program. We offer both classroom, lecture, and hands-on practice opportunities. Access to Comprehensive Academic Medical Center. I'm sure you all are aware. We strive to provide close relationships and networking opportunities with our local, regional, and state agencies, both nonprofit and government. And then we have 5 concentrations you can choose from. We have 2 in-person concentrations of environmental health and epidemiology. And then online, we have 3 concentrations. We have health management and policy, program planning, management, and evaluation, which is brand new for the fall of 25. And then also brand new for the fall of 25 is our personalized option. We are still in development for that, but it allows a student to sort of handpick what their interests are. As long as they meet the overall competencies of our program, we can provide them with various core classes and elective opportunities to meet those needs. So that requires more of a one-on-one planning and advising. I will also say with our core classes, because we have these online concentrations. Some of our core classes have to be offered at least online. Some are offered both online and in person. So even in your in-person concentrations, you may have a semester or a year where the majority of your classes are online because of that requirement for our core classes. But then when you get into more concentration specific courses, then those will be in person. Okay. With our part-time MPH, it is 3.5 years, depending on what concentration you're in. We do offer a practice-based MPH degree. So when you finish, when you complete it, you can automatically get out into the workforce. We tend to focus on people that like to go in and get your hands dirty, so to speak, and work in the communities, work with different populations, make them healthier. And we're designed to meet the needs of recent undergrads as well as current public health and clinical practitioners. Once again, we offer both the full-time path and the part-time path for our MPH. So I mentioned a second ago the core classes. With our MPH, you're required between 42 and 43 credit hours. You may be asking yourself, why is there a range there? When you look at CPH 663, Foundations of Public Health, we do not require that for anyone that has a BPH from a CEF accredited institution. Okay, so if you got your BPH, just going to use UK for example, if you got your BPH here, then that class is waived and you do not have to take it. So that means it's a 42 credit hour program. If you do need 663, then it becomes a 43 credit hour program. As I mentioned, 5 concentrations, 3 online options. For our online options, those we strive to have them all asynchronous. So that it does not interfere with your workday. You can complete those tasks or those modules after work and still receive the same education as you would from the traditional viewpoint. Of our concentrations, environmental health, again, it's an in-person concentration. We will train you to apply environmental health sciences to analyze specific mechanisms by which exposures to environmental contaminants may affect human health, identify populations at risk, generate evidence-based products using communication strategies, recommend collaborative approaches for reducing environmental exposures, examine policy and assess policy needs, and then translate data to inform policy practice, individual or community decisions. So again, a lot of public health, instead of dealing one-on-one with patients, we deal with communities. So we try to analyze instances or trends and relate those into a sense of creating healthy communities, impacting policy and things of that nature. So epidemiology, again, another in-person concentration. What we strive to do is have students analyze disease transmission, prevention, and control, evaluate factors that increase or decrease the risk of diseases, design studies to evaluate exposure, formulate and implement different approaches to adjust and affect measures and generate appropriate conclusions. And then evaluate distributions of disease in terms of geography, population groups, and time. So again, it's not one-on-one patient interaction, it's more broad community aspect. And then we're going to go to probably our most popular online concentration, health management and policy. Again, this one is 3 years part-time pace. including summers. I think the first summer you'll have 2 classes, the second summer you'll have 1, and then you'll be finished with the program by the third summer. Um, so we will teach students how to evaluate multiple service delivery and financial systems, apply tools associated with the management functions of planning, organizing, leading, and controlling, apply approaches for measuring performance related to population health outcomes, apply appropriate methods to analyze organizational issues, and then apply methods to improve organizational performance, including quality, safety, equity, and consumer experience. Again, this is our most popular online program or concentration. And it's been around for, I think we're going on 4 years for H&P. Program planning, management, and evaluation is also an online concentration. It is brand new for the fall of 25. So our first students are just experiencing this, but we hope that when they graduate, they will be able to recommend strategies for community engagement, prioritize health needs within a community, plan community interventions. What do those look like? Develop strategic management skills for implementing community level programs, and then how to assess those programs to see what needs to be tweaked, changed, substituted, things of that nature. Our personalized, it's not as plain and simple as the others, because although we do have students pick and choose what they want to study, they do still have to meet those the same competencies that we offer through our MPH program. So it's not the wild, wild west when it comes to selecting courses. They still need to select courses and check those competency boxes as they move forward in the program. It is also brand new for the fall of 25, and we do not have students in that concentration yet. So our DRPH program. Again, this is also brand new for the fall of 25. There's been lots of changes in our college recently, in case you haven't noticed. But it is a totally online asynchronous program. Consists of 42 credit hours. At a full-time pace, it's a 2.5-year program. At a part-time pace, it's a 3.5-year program. We do look for people with some public health or healthcare experience. So it's not a fresh out of college degree. But it is a practice-based degree. It is not a research-based degree. So that's something to keep in mind as well. We want to develop leaders and send them out to benefit the people of, Lexington, the region, the state, the nation, and network with other public health practitioners in those areas and across the world. Something to mention, we talked earlier about the EEP benefit. Hopefully everyone here has heard about that so far. About the EEP benefit, more information at the HR website. Stands for the Employee Education Program. It will cover up to 6 credit hours of tuition per semester. That's fall, spring, and summer. Up to 18 credit hours per year. During the final year of your program, you can cover up to 9 credit hours for one semester. So if you are a little bit behind, we may be able to catch up during your last year. And then once enrolled in a degree program, you will need to submit that EEP form every semester, including summer, in order for that benefit to be applied to your account. We do have a new tuition assistant administrator, Brevin Waker. Here's contact information, direct email, and then general email. And I believe they will be present at your fair later on this semester. So how do you apply to our graduate programs? This is for all the programs I discussed except for the BPH. For the BPH or for the FIDS program, you will follow big UK admissions procedures. But for the graduate programs, we start with SOFIS, sophis.org. There's a QR code down here if you'd like. You would go in, start your SOFIS application. It's a third party, so we have no control over SOFIS except to submit the information for each program within that realm. And then they will ask for letters, 3 letters of support or recommendation. Any official transcripts from institutions you've attended. This would include if any of you have dual credit classes that you took in high school. This does count for that. So you would need official transcripts from those institutions. You would provide a statement of purpose. You would also provide a writing sample. The difference between the two is a writing sample would be a prompt provided by our faculty, and the statement of purpose would just be, why are you interested in the program? How would it benefit you? How would it benefit your career? How would it benefit public health in general? Okay. We are test optional, which means no GRE is required. But that is the first step, is the SOFIS application. Please note that there is a difference if you want to apply to our in-person MPH concentrations or our online MPH concentrations. In person is April 1st. Online is July 1st. And then deadlines for the DRPH is February 1st. MHA is also April 1st. And then once completed with step 1, you would submit your application, we would review it. If you are admitted into the programs, for all programs except the DRPH, you would also need to do a supplemental grad school application. The DRPH is all in-house, so we take care of that. There's my contact information. If you have any questions, or if you would like to go ahead and schedule a meeting to discuss anything specific, please use the QR code to schedule that. Otherwise, you can feel free to email me with any questions you have, give me a call. If it regards a different program, I will forward you to the correct person, and I'll help you out as much as I can. I think that's it. I think the Q&A slide is next. Yep.
Thank you so much, Benji. That was excellent. I want to add 2 things to your presentation, which was excellent. I haven't had you present this in a long time, so it's been several years. And I know there have been so many updates and changes to your programs. Well, for those nurses that are on today that have their associate degree, the College of Public Health offers that bachelor's in public health, BPH, but that does not fulfill the requirement that UK healthcare nurses are required to finish their bachelor's BSN in 5 years. So I just want to make sure that everybody understands that. Also, Benji mentioned our October 30th UK Healthcare annual education fair. Benji and about 29 other college programs will be there in attendance, which will be awesome. They will have flyers, curriculum information, tuition information. Our tuition folks will be there. Benji mentioned Brevin, who works in our UK employee tuition office. He will be there in person to answer any questions that you have about that. So definitely mark your calendars for Thursday, October 30th. It will be in the Kentucky Children's Hospital in that large conference room right behind the gift shop. So again, once a year, you can come through, you can visit several different programs, on your lunch hour, and pick up a lot of great tips. Sometimes the colleges will offer their admissions fees, their application fees will be waived if you do come and visit their table. So please plan to attend that. I don't know if we can unmute you, but we would love to have your questions. I did get a couple that came in through the registration. So if you'd like to put your questions in the chat, I'll monitor those, or unmute yourself and ask Benji directly.
Sue, I was just bringing up that document you shared with me, and I'll touch on some of those while we wait.
Okay.
The one question was, how long do these programs take? Will there be any scholarships available, and which programs are online? So I'll start with the last part first. So our online programs would be the HMP concentration of the MPH, the program planning management concentration of the MPH, and our DRPH program. Those are currently the only degree programs we have online. We also have the population health certificate, which is 12 credit hours of our core MPH classes, but it is also available online as well. For the scholarships question, I will say that once you submit your SELFIS application, we have embedded scholarship questions within that application. So instead of applying for both the program and for scholarships, we just ask you to do that one SELFIS application, and then we save that data. And as things become available, we will reach out to you and let you know what's going on. And then how long do these programs take? I think I covered that in the presentation. But the MHA full-time is 2 years, part-time is 4 years. For the MPH, full-time is 2 years, part-time is 3, maybe 3.5 years. And then for the DRPH, full-time is 2.5 years, part-time is 3.5 years. I see some questions popping up in the chat now. A location that has the DRPH curriculum, yes. So that is both on our website and on UK Online. So let me get those links while I'm talking about it. That program is also still under development. We had to pause. I think I mentioned this in my presentation, but if not, we had to pause for our accreditation review. So the faculty went back to work as soon as school came back in session. But the first half of the program is pretty solid. They're still working on the back half of the program. Okay. Because of that, the first cohort was 10 part-time students to sort of slow down the pace a little bit while they work to complete the back end. But like I said, I will find those links and put them in the chat. It's hard for me to talk and navigate at the same time. So thank you all for being patient and understanding. Okay. Here is information about the RPH program. And that, if you click on the curriculum button that's on the right side menu, and look at the concentration, there's only one concentration. I did forget to mention this for our DRPH, and that's public health leadership. But it will have a list of the concentration competencies. And then maybe it's on UK Online. There's also a UK Online page that I'm going to share also. And I believe the course listing is on this page. So the courses are listed, but we may not have much more information than that right now, because the courses may exist at this time by name only. And they will be developed fully, but as of right now, they may not be. We'll just keep that in mind.
Benji, do you see the question that came in from Stephanie Clark?
I was just reading that. What types
Okay.
of internal UK healthcare and university positions and grade levels would these degree routes open up for persons who complete the degrees? It's hard for me to say specific grade levels. So I'm going to be a little vague in this answer, Stephanie. But I would say students that have completed our, in particular, our HMP concentration, they have gone on for more management or leadership or administration roles. Obviously, our MHA programs provide opportunities for administrative duties, budgeting, HR management, things like that. But with our MPH, HMP concentration specifically, I've seen several part-time students obtain that here at the university and then gone on to bigger and better things. Both here, elsewhere, like I said, they could be nonprofit, they could be local, regional, statewide. We do have a couple of faculty members that also work for the state government. And so there's interaction there. I know that Dr. Stack with the Kentucky Department of Public Health has also been working with faculty in development of the DRPH program. So I think that's going to be, like a blue ribbon type of program that's promoted all across the state. So yeah, I can't give you specific grade levels, but I could answer generally like that.
Thank you.
You're welcome. I hope that helped. Let's see. Are students able to take classes at a slower pace than part-time, or is there a requirement to complete the degree? So, Kayla, according to the graduate school, you have 6 years to complete your graduate degree upon admission. Now, after those 6 years, we can appeal for another 2. And then after those 8 years, we can appeal for another 2. So, soft answer is 6 years. The real answer is you can have up to a decade to complete your degree. I've got students personally that can take 1 course a semester because of their workload, their time management. We make it work. We make it work. If you're in the program, you're not locked into a designation of full-time or part-time. Those are pretty flexible. We can go back and forth. Also, part-time is just less than 9 credit hours. So if that's 3, if it's 1 class, we make it work. If it's 6, 2 classes, we make it work. But yes, it is doable. And it is possible just to do 1 course a semester. Maybe you'll get lucky and every now and then do 2 courses a semester. But the main thing is, if you do that, I would be a big proponent of using the EEP benefit. I can't say that enough. I had a student this past year that was desperately worried about paying for graduate school. And so she was already applying for jobs. So I encouraged her to seek out jobs at UK just for that reason. And she did. She got hired, and now she's using that benefit to get her master's degree. That's how I got my master's degree at a different institution. So I highly recommend that path to anybody that has any concern about paying for graduate school to advance yourself. There are opportunities, and we will make it happen. The time frames tend to differ because sometimes life happens and we have unexpected things pop up. And so, yeah, it is possible to do a slower pace than 6 credit hours. That we would just need to make an individual plan with you, Kayla. Does the letter of recommendation have to be submitted with the application, or can it be emailed after? So, I don't see a name, so I'm just going to say EPE. So what happens when you begin your SOFIS application? Emily, thank you. Sorry, no. It's going to ask you when you get to that section, it's just going to ask you for a name and an email address, and that's it. SOFIS will automatically send an email to those recommenders, and then they will evaluate you on a Likert scale, which I think is important to tell them, because the actual letter of recommendation, as we all think of it, is optional. So they may not have to submit an actual letter if they complete the Likert scale and enter comments. But they do have the option of submitting an actual letter. Okay. And you can submit your SOFIS application before those letters are attached to your SOFIS application, because we can see that they have received the email and they have been notified that they need to submit something or submit at least an evaluation. Just know that until those recommendations are included in your application, that we will mark your application as incomplete. So just keep that in mind too. Sometimes people forget and you've got to nudge them and remind them. And you don't want to catch anyone off guard with an immediate request to write a letter or to be a recommender. For the in-person only courses, how often do these classes usually meet? So Bruce, so for the graduate school or for the graduate programs, I think epidemiology has moved to a format where they meet twice a week for roughly an hour or an hour and 15 minutes. So it's sort of very similar to what the undergrads experience. For the other concentrations, the more typical route for graduate work is you meet once a week for 2.5 hours. If you're in an online program, it's going to be asynchronous, which means you can do the work at your own pace after working hours. And you'll still have deadlines and due dates, but those will be, if you prefer to work at 11 o'clock at night or 1 o'clock in the morning, then that would be fine. As long as it's done by the deadline or the due date, then you'll be perfectly fine. Does the EEP cover any degree offered at UK? I believe so. I've known of students to use it for undergrad degrees, for certificates, for degree programs, and for doctoral level courses. So I would double check with HR because I'm not an HR representative, but I'm fairly certain it covers any class or program at UK. Oh, Mimi just answered. Yes, undergrad and certificates.
There are small fees that I've had to pay, like a particular class specific. I don't think it's been anything over $80, and you pay for books and supplies and stuff, but the rest is covered.
Thank you for your input. I was just talking to Sue before this session started as well. I'm going to share this, Sue, but I've been doing this role for about 4 or 5 years here at UK, and I have yet to receive a negative comment about the EEP program within UK HR. They've always been very responsive to students. They've helped students out even when deadlines are missed. They've still helped them out. They've adjusted, when life events happen. They've adjusted things there, but they've been extremely pleasant to work with. And I will be a big fan of them for as long as I can.
I agree, Benji. Also, I want to mention there are so many myths out there about our tuition benefits. It starts the very first day that you work here. So if you started on orientation on June 1st, 2025, your EEP benefits started on June 1st. There's no wait and see time frame. Also, there's no contract involved. You don't have to sign anything. We obviously, once you finish your degrees, we would love to have you stay here, but we certainly understand that the advancement opportunities may be elsewhere. So you don't have to stay for an allotted amount of time like you do at other institutions that require a contract to sign. Benji, I think you got another question from Christina.
Yes, ma'am. So Christina, I'm going to answer the second part of the question first. Is the market in need, or do graduates tend to struggle to find jobs? with public health is really everywhere. You just have to know how to talk about it. So I would say, it may depend on how you sell your skills. Because public health, a lot of people don't know what it is, but they know it when they see it. And unfortunately, it's often categorized as just working at the health department, and that's it. But we always start out, recruitment events with undergrads is how did you get here? Did you drive in a car? Were there speed limit signs? Were there stoplights? Were there stop signs, yield signs, crosswalks, seat belts, airbags? Where is the building you're in? Is it ADA accessible? Are there means for all people to get in and out of the building safely? What are the safety measures? Are there fire alarm pull stations? Are there fire extinguishers? Are there carbon monoxide detectors? So it's things like that, that normally go out of sight, out of mind, but they're still important. We still need to analyze things. We need to track illnesses and sickness and find the common root of the issue, whether that's the disease itself, or if it's heightened in a certain area or a certain demographic, we can find out why. So a lot of it has to depend on how you market yourself and how you market your skills and what you've learned in our program. Because most job descriptions that we have seen do not promote public health in general. You've got to find ways to kind of work it in. I'm not sure if that answered your question, but that's feedback we receive from our students, is that they just need help explaining to people what public health is. And we find that when we recruit as well. I'll also say there tends to be a fear right now of the unknown when it comes to healthcare and public health in general. And I'll just leave that alone right there. So I'm not sure, hopefully that'll change in the future, but I'm not sure how we market past that. There's a classes between the bachelor's that was received and the master's. Mimi, can you explain your question a little bit? I'm sorry.
I'm sorry, I probably worded that wrong. Is there any reciprocation between the bachelor's program that you are doing or achieving and the master's that you choose? Like any classes that count towards the master's or?
Oh, no, I'm sorry. That's a UK and a grad school rule, but any course that is applied to complete another degree, we can't count. And grad classes have to be at a level 500 or above. And so we can't really count 200 or 300 level classes as graduate classes.
Okay, thank you.
You're welcome.
Got a couple minutes left. Any other questions? This Q&A has been fantastic. Benji, keeping you on your toes.
No, I love it. I love it. Usually people just stare at me, so this is nice.
I know. It's great. I mean, I've been taking 2 pages of notes.
Well, I don't know if I missed something in the beginning, but is there any more information on the MHA?
What do you want to know?
Like I saw some slides where you had like the coursework and the credit hour, how that broke down. Do you have anything on the MHA?
Yeah,
I might have missed.
Are you asking about coursework for the MHA
Or yeah, like the total hours and the, you kind of had some breakdowns for the other ones, but I didn't know if I missed the MHA one.
No, you're fine. So the MHA is a 50 credit hour program.
Okay.
Full-time pace is 2 years. Part-time pace is 4 years.
Okay.
I can let me share a link with you for the program page. You can explore this a little bit. It's got some curriculum information there as well. And if you have any other questions after this, just let me know or let Ashley know. Let me put her contact information as well. I used to be responsible for all graduate programs, and then we did some restructuring
Okay.
in the spring semester. And now MHA is to another person and the science programs are to another person. So
Okay.
that's the only reason I'm divvying out this information, but
Who
Oh.
is the person for the science graduate degrees?
that would be Dr. Ellis, Dr. Amanda Ellis.
Okay,
I can put her information in here as well.
that'd be great.
You're welcome. I just can't talk and type at the same time.
No, you're good.
Friday, I've got about 1 more minute. Any other last minute questions? Looks like we've got one more from Alyssa. Benji, navigating current student loans and forbearance, loan forgiveness at UK, new enrollment costs and how those interact. Who do they talk to?
I would encourage you to speak with the financial aid office and the financial aid professionals. That topic changes constantly, and I do not want to give you wrong information. So I would direct you to that office and talk with the professionals.
I totally agree. I used to work next door to financial aid and it was, I respect them so much. Unbelievable. Kristen has just put our, brief evaluation in the chat. And so please fill that out. We will be sending this PowerPoint and evaluation out. And the video recording will be on the Career Center website, probably hopefully next week or two when UK Marketing approves it. So again, thank you all for your participation today. It was awesome. It was great to see so many of you. I know I've worked with many of you over the years, and it always warms my heart when you say, now I want to go on for an advanced degree. But anyway, thank you. Thank you so much, Benji. Benji and Kristen, if you can stay on with me for a few minutes, and we'll say goodbye to everybody else. Have a great rest of your day. Thank you, guys.